The path of the research took me through many of the topics I have studied, like information technology architecture, interoperability between systems, security, developing applications and user interfaces, and learning about standards, guidelines, and regulations surrounding information technology. Telehealth, mHealth, and eHealth are essentially the same. The macro definition is that medical informatics can be shared by mobile or home devices to healthcare providers. The devices send data to provider locations. The first recorded transmission in 1948 was sent 24 miles and was carried on phone lines. Telehealth did not start gaining momentum until advances in technology caused an increase in how patients and providers started interacting with each other on a whole new level. Patients are using mobile devices to track and help manage diseases like diabetes, but they are also setting and meeting fitness goals to maintain their health with devices like Fitbit. With millions of devices tracking health and transmitting data, there are concerns about the integrity and security of mobile transmissions and concerns about interoperability of mobile devices and electronic health systems. Standards and guidelines are not fully developed, and because technology advances at such a rapid pace, they quickly outgrow what standards were developed. Another issue that holds the standards back is the Health Information Exchange, or HIE. The intent of HIE was to provide timely sharing of patient information for better health management and improved decision making while decreasing duplication and errors. However, barriers are preventing HIE to become fully useful. One of the barriers is there has been little buy-in from stakeholders because trust is shaky when it comes to sharing perceived proprietary information. Also, electronic health systems are mostly based in siloed environments, so are not able to relate to each other in a meaningful way. Middleware is the layer between systems that aids in interoperability, flexibility, and connectivity with mobile devices. Middleware is scalable and increases engagement with patients and their health information. Again, stakeholder buy-in is slowing the gears of progress, but primarily because of insufficient HIE standards and guidelines. Another point that slows integration of systems is the cost factor involved with providing interoperability. In a survey of nurses nationwide, 60% say medical errors would decrease if hospital medical devices were interoperable. Patients are being put at risk as a result. Middleware is not new. Banks, retail, and other industries have been using middleware to tie in their complex systems for years. Middleware provides an answer to electronic health records while healthcare waits for HIE to catch up. Middleware solutions translate data between electronic health record systems, EHRs, and provide a user interface. The user interface allows data to be displayed in a meaningful representation for analysis. According to Volz and Tran 2015, middleware goes beyond the simple gluing of two disconnected systems together. It often serves to synergize and get more than the sum of the two systems together. Another technology that shows promise as a middleware is blockchain. Blockchain was developed in 2008 as a digital ledger technology for Bitcoin, a cryptocurrency. While blockchain shows it has promise as a solution to other types of middleware, and that it may provide the answer to telehealth data integrity and security, issues do exist and must be resolved before integration could occur. Because EHR systems are customizable, middleware is quite possibly the best solution to address EHR interoperability. Integration of middleware into EHR systems will enable seamless connections. This will create a universal view of patient records no matter where they are located. The growth of middleware and software as a service markets can help provide some of that functionality without the cost burden on providers and demands on EHRs. Middleware coupled with EHR system protects and extends healthcare IT investments. Healthcare vendors are looking to other industries to analyze how they have developed and integrated middleware to provide interoperability with their complex systems. These industries include banks, retail, and transportation. The possibility that middleware will drive change in how EHR transforms is high on the probability scale. Alternatives to HIE include personal health records, which eliminates control challenges. It is a consumer-based model and lowers the cost of technology. However, it requires exchange partners who are technologically capable and willing. Personal health records also lack single data repository. Option 2 is the health information technology for economic and clinical health, otherwise known as high-tech. High-tech allows providers a minimal participation in HIE. The objective is to improve quality and reduce cost. The High-Tech Act was designed to help ease providers into acceptance of EHR, but because issues still exist with EHR, like security concerns, privacy, and changes in workflow, providers are slow or unwilling to adopt. Option 3 is to treat HIE as a public good. This could incorporate a wider geographical concern, such as a metropolitan and urban area, which would add to quality gains and overcome concerns of competition between providers while adding to sustainability. On the other hand, adoption of HIE as a public good by stakeholders could be a complicated process. We simply could not discuss telehealth and telemedicine without bringing up the Internet of Things. Patients want to have access to their health information and to their provider without expensive trips for an office visit. And that's regardless if some of the devices in the Internet of Things have sufficient levels of security. The lack of security is illustrated by the number of DDoS attacks that include Netflix, PayPal, and others in late 2016. Consumers in healthcare, otherwise known as patients, are faced with increasing costs of healthcare and are seeking alternatives in self-care. Consumers are a driving force in products and services around the globe. This has always been the case and is the primary base that drives economics and organizations. And it is the drive that will push developers to provide higher levels of security. The most promising value from health data comes from connecting the pieces. Healthcare 2.0 vendors have demonstrated that middleware-based EHRs go far beyond the limitations present in non-interoperable EHRs. Adding additional functionality to patient data has been accomplished with a seamless connection to disparate EHR systems. An additional benefit of this technology is that frontline providers no longer need to worry about accessing many different systems to manually utilize data for patient care. Through middleware, the standards of software as a service will provide benefits and value using existing infrastructure to provide interoperability for healthcare. Black Book's 2016 evaluation of middleware vendors user survey found the highest user satisfaction in 3 middleware products: Healthmark, Zotex, and Arcadia Healthcare Solutions. Through research, it was determined that HIE is one of the greatest barriers to meaningful outcome to patient care. Many issues must be addressed to bring fragmented systems together. Organizations and collaboratives need to work to find common goals and move forward with knowledge gained from past failures. There must be more drive to build confidence and to emphasize stakeholder buy-in. Steps have been taken and consortiums formed to help guide standards of blockchain in healthcare. Blockchain could be a solution, but needs more work to mature in the healthcare industry. Middleware does face security challenges, but these can be overcome, so they do not present a barrier to providing interoperability. Middleware allows developers to focus on healthcare applications, inspires solutions, improves patient care, lowers the IT healthcare cost, and extends EHR usefulness.